Hello, everybody. We are going to get started. First, a very special thank you and welcome to each of you for joining us today. Just one quick technical note before we begin. We have such a great group joining us today, so we need to keep everybody muted. But please know we welcome your questions and I encourage you to use the chat box as questions come up. We will be monitoring the chats as we go along. My name is Kristen Apin. I am the Executive Director for Autism Speaks. My field team and I cover Sussex County down to Ocean County, and our office is based in Princeton, New Jersey. We have 4 walks and 1 gala that cover those counties, and we welcome all of you to join us this year. As a field team, we work with our volunteers and constituents in our local areas to help fuel our mission. At Autism Speaks, we are dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of individuals with autism and their families. We do this through advocacy and support, increasing understanding and acceptance of people with autism, and advancing research into causes and better interventions for autism spectrum disorder and related conditions. Through partnerships and collaborations, we are committed to 5 mission objectives: increasing global understanding and acceptance of people with autism, being a catalyst for research breakthroughs, increasing early childhood screenings and timely intervention, improving transition to adulthood, and ensuring access to reliable information and services through the lifespan. An integral part of all of our work is the process being made in the area of advocacy. We are so excited for this opportunity to share with you just some of the progress that is happening, especially here in New Jersey. It is my pleasure to introduce Judith Ursitti, Autism Speaks Director of State Government Affairs.
Thank you very much, Kristen, and thank you, New Jersey friends, for joining us this Friday. Yes, it's Friday. And today we're going to talk about advocacy on the state and federal level, and we're going to talk about supports and services that are available to you during this time of really challenging COVID-19 experiences. We've heard from many of you, and some of us are parents and providers, people who support those with autism spectrum disorder, and there are so many challenges that we're facing during this time of COVID-19 that really has shaped the policy that we're pursuing in Washington, D.C. and also in Trenton. I know many of you are experiencing an abrupt discontinuation of educational services. My son today was just doing some teleeducation. He made it 30 minutes with his online teacher. And he's able to do that just a few times a week. So it's very challenging as he's used to going to school year round and going to school all day. So such a different kind of experience. Day programs are closed right now in New Jersey and around the country. Clinics are closed. We're shifting to telehealth, which for some is great. And for others, it's very challenging. Mental health is such an issue for our community, not only for parents. Parents definitely need mental health supports. And I will say I'm utilizing them during this time myself, and I encourage you to if you need to, but also for siblings, for people on the spectrum themselves. There's a lack of connection to the things in the community that we're used to. Attending church, being part of Special Olympics or activities. My son Jack is 16 and he has autism and a severe intellectual disability. And many of you who know us know that every Saturday night for pretty much the past decade, we've been at Outback Steakhouse. And it's an experience for him that's just familiar, comforting, something he asks for every Saturday. And so to not be able to connect in that way to the hostess, to the wait staff, you know, those people that he's really grown to love and who love him back, it's a loss. And yes, we do drive through and pick up food from there, but it's just not quite the same. And that may seem like a trivial example, but for Jack, I will say it's very important. Employment has been disrupted. Respite, which is so important, has been disrupted. Families have lost their income, and it's already challenging enough living with autism and the economic challenges that we face, but this profound loss of income is so hard. We're dealing with challenging behaviors, which is so hard. Self-injurious behaviors, aggressions, and trying to manage that without the right supports is just next to impossible. And then of course, there's been concern about healthcare and access to healthcare, and what that looks like, and if loved ones can be with people with autism when they're hospitalized or accessing healthcare. So those are some of the things that have shaped our policies. So today we're going to touch on those things as we talk about what's going on with advocacy on the federal level and also on the state level. And as Kristen said, we really encourage you to engage. I'm sorry everybody's muted right now, but we want to engage, so please feel free to type questions or comments in the chat box, and we'll work on addressing those as we go. If you have an individual kind of specific question, many people don't realize we have an amazing autism response team that you can reach by phone. There's a line that you can call if you need to engage in Spanish, or you can email help@autismspeaks.org. Please know you can do that. The people who staff the autism response team are amazing human beings. They've got a lot of good information and they're there to help. All right, whoops, I went too far. So quickly, I will tell you, we heard from Kristen, and now we're gonna move to Dave, who's gonna give us a federal update. I'm gonna talk a little bit about state advocacy priorities, and then Jenny Green's gonna tell us about services and supports that are available during this time. So Dave, I'm going to turn this over to you if you could talk with us about what's going on federally. A lot's going on today.
Yes, indeed. Thanks, Judith. Great to be with you all today. As Judith mentioned, my name is Dave Sikowski. I work on our federal advocacy team based out of Washington, D.C. And so today what I'm going to do is provide a broad overview of the federal activity that has been occurring in Washington, talk about some of the specific priorities that Autism Speaks has been fighting for, based on hearing from the community and hearing from people like you to bring to the forefront to decision makers, and then talk about what is potentially up next in terms of additional federal action. So I'll note that for a lot of these bills and a lot of the things I'm going to be talking about, each of them individually, we could spend hours on. And I know that there may be some specific questions, and so I'd encourage you to put any questions in the Q&A box or the chat box, and we'll be happy to address those as we go, or if we can't get to everything on the call today, happy to follow up. So in terms of the federal response to the COVID pandemic, March 6th was really the first bill that was passed that was specifically related to addressing the crisis. And that bill was the Coronavirus Preparedness and Response Supplemental Appropriations bill. And that was to provide an initial tranche of money to the public health response, amongst a number of other important provisions. One thing I'll note here too is you'll see we've written COVID-1, COVID-2, COVID-3. That's just kind of the way that these bills have been discussed, even though each of them have their own names. It's kind of been discussed in this particular order. So March 6th was COVID-1. March 18th, COVID-2 passed. This was the Families First Coronavirus Response Act. This included a number of things to address direct type of assistance for individuals and families related to the crisis. So for example, providing emergency paid sick and family leave, free COVID testing where it's available, of course, food assistance, and an increase in Medicaid funding. There was a 6.2% FMAP increase. So a number of items in that law that were important. On March 27th, COVID-3 passed. That was the Coronavirus Aid, Relief, and Economic Security Act. This is the bill that you have all heard of, provided $2 trillion in funding for a whole host of different things. So assistance to individuals and families, those $1,200 stimulus checks, or they're called economic impact payments by the IRS, that went out to each individual, $500 for dependents, under the age of 17. Hundreds of billions of dollars to address the public health response and to state and local governments. Assistance for small businesses to retain employees. This is the Paycheck Protection Program that provided $350 billion in potentially forgivable loans to businesses. Billions of dollars for education is the $30 billion total, divided up in several ways, and Judith will touch on that a little bit later on in the presentation in terms of how that money is divided up and what Autism Speaks is doing to advocate for those expenditures in the state and local level. And finally, there was an extension of the Money Follows the Person program through November. Go to the next slide, please, Judith. Thank you. So between March 27th and April 24th, and frankly, even ongoing now, there's been a lot of discussion about what additional relief needs to be provided. And the idea being that there's going to be another, potentially another package on the scale of that $2 trillion relief bill, the CARES Act, at some point. However, there are some specific issues that arose that Congress worked to address in a more narrow fashion. So the Paycheck Protection Program, the Small Business Assistance Program we just discussed that provided forgivable loans, ran out of money quickly, and there was a need to replenish that amount. And so through some negotiation that occurred, a bill, COVID 3.5, the Paycheck Protection Program and Healthcare Enhancement Act, was put together and passed. And in addition to replenishing that small business assistance program, it also included funding for some funding for hospitals and testing as well, but limited in scope. So if we can go to the next slide, please. Thank you. So, as I mentioned, we've been doing a lot of listening to try to understand the specific challenges that individuals and families in the autism community are experiencing, and trying to convey those to our legislative champions and look at policy that could be helpful during this time. Here's a list of some of the priorities, and again, I'm happy to address these in more detail if there are specific questions. But providing additional funding for home and community-based services where they're available, and to try to provide to ensure that there's PPE available, that we're ensuring a continuity of workforce for what is a very vital service. We've been advocating for additional funding to meet the educational needs of students with autism. This is looking both at the challenges right now in terms of distance learning, which is by no means a substitute for the comprehensive programs that students would normally be getting, but if there's a way for more to be done to help at this time when students are at home. We're looking at that, but in addition to that, we're looking down the road at when students are able to return to school, ensuring that schools have the resources to immediately be able to start addressing the regression that we know has occurred for a lot of students. And so we're looking at it in terms of policy on both of those ends. Protecting the rights of students under the Individuals with Disabilities Education Act. This was something that has been discussed quite a bit over the past several months. When that CARES Act that passed that I mentioned on April 27th, or I'm sorry, March 27th, prior to that being put together, there was a lot of concern that that legislation would include waivers of the core protections of IDEA. That was something that we disagreed with strongly, that we didn't think there was a need to waive those core protections, that the law itself already provides the flexibilities needed. We communicated that with Congress, along with a number of other advocacy organizations as well. And fortunately, no waivers were included. What was included was a requirement that Secretary DeVos issue a report basically laying out any needs for waivers of IDEA. And in that report, which was issued on April 27th, the Secretary did not ask for any protections, or I'm sorry, any waivers of the core protections of IDEA. So in our minds, that was a good thing that no waivers were recommended, but we also recognize that that doesn't eliminate the challenges that students and families are still experiencing in terms of educational opportunities. And so we continue to advocate strongly in this space. Expanded access to telehealth services for healthcare needs, and ensuring that those services are being provided appropriately for individuals on the autism spectrum. Eligibility for the $500 economic impact payments for dependents over age 17. So as I mentioned in the CARES Act, only dependents under age 17 were included, which we know leaves a lot of people out, including many in our community. And so we have joined in supporting efforts to fix that. There's a lot of support in Congress and a lot of advocacy organizations as well pushing for this to occur. According to caregivers of adults with disabilities, the same paid sick and family medical leave policies according to caregivers of children. So going back to the emergency paid sick and family leave that was provided in the March 18th bill, there were a number of categories that allowed people to be eligible. One of them is if your child's school or daycare center is closed, you're eligible to be able to take advantage of emergency paid sick and family leave. However, there was less clarity around caregivers of adults with disabilities whose normal source of care is no longer available. We advocated strongly that they should be, and fortunately the Department of Labor, and along with other organizations as well, and we're pleased to see that the Department of Labor agreed with that and has been interpreting the policy in that manner. Lastly, but extremely importantly, preventing discrimination in treatment decisions and care allocation based on disability. The HHS Office of Civil Rights issued guidance on this. We applauded that and put that information out, and we're hoping that every medical provider across the country is looking at this and ensuring that this discrimination doesn't occur. So one thing I want to mention is that we are very fortunate that we have incredible champions in Congress. Congressman Chris Smith and Congressman Mike Doyle, the co-chairs of the Congressional Autism Caucus in particular, have been sending letters to congressional leadership advocating for many of these priorities. They've now sent multiple letters. They've been rallying their fellow colleagues to join these letters and have been staunch advocates for these priorities. And we're really grateful for their efforts and for the efforts of their colleagues. We've also joined them in fighting for these priorities. Judith, if you could please go to the next slide. So what's next? So as I mentioned, there's still a desire by many to do another large relief package. However, there's different ideas in terms of what shape that should take, what the timing of that should be. And so negotiations are still ongoing. Now, you may have heard on Tuesday, House Democrats introduced the HEROES Act, which is a $3 trillion relief package that covers a myriad of things. Most notably, $1 trillion in relief to state and local governments, but a whole host of other provisions from housing to healthcare to the postal service. The way that I think we look at this is a kind of an opening salvo in terms of the negotiations related to another bill. There hasn't been consensus, certainly in the Senate, on this, that it's unlikely that they're going to take this exact bill up soon, or if in this form. So, I want to emphasize that, while there are things that I'll point out in a second that are important for our community that are included in this bill, that there's still a ways to go. And so we're going to continue pressing forward and trying to ensure that our priorities are included, maintained, and enhanced. So some of the things in the HEROES Act to know is there is a substantial increase in funding for the home and community-based services, $100 billion for education. It's dedicated funding beyond the $1 trillion in general assistance. It provides a fix to the issue I mentioned related to dependents under the age of 17 not being eligible for the $500 payments. The HEROES Act also actually includes additional $1,200 payments per family or per individual. And then there's a clarification on the emergency paid sick and family leave, just to make sure that that's clarified in statute. And then $10 million for Developmental Disabilities Act activities. So the House is actually in session today. It is, they're voting on some procedural motions related to this right now, as well as the ability for the House to convene in a remote way. And from there, the path is unclear. I think that there's going to be a lot of additional conversations, negotiations over the coming weeks, and we will see where things go. But in the meantime, we're going to continue on our part, listening to the community, listening to all of you, getting your feedback, and continuing to work with our champions in Congress to try to ensure the priorities of our community are heard and included. So with that, I will turn it back over to Judith and Kelly for any questions.
Thanks, Dave. This is Kelly monitoring the Q&A and chat. We have a couple of questions, but they're relevant to the state section, so we'll hold those until after Judith has shared her information on state advocacy.
Okay. Thank you, Dave. And so we will just move right ahead and talk about state advocacy. I'm Judith Ursetti, Director of State Government Affairs at Autism Speaks. I've worked with many of you over the years. On the state level, we spend a lot of time working on health insurance coverage and Medicaid and so many other things. So it's really great to be with you all today. We talked earlier about the lists of challenges that our community faces right now. And as we try to think about meaningful advocacy, we don't want to do things just to, tweet something or pat ourselves on the back. We actually want to work on issues that are meaningful to our community. Level 1, Level 2, Level 3 autism, females, males, all across the lifespan, which, as you all know, in the community, it's hard to do that. So we focused on 3 different areas. We focused on healthcare, we focused on home and community-based services, and then also those that are consuming services from special ed and early intervention. So let's start with healthcare quickly. For those of you who use Medicaid for your health insurance, New Jersey actually was approved for a waiver. It's called an 1135 emergency waiver. It was approved by CMS. And CMS is the federal agency that oversees Medicare and Medicaid. So all of the Medicaid services have to be approved by CMS federally. And so these flexibilities have been approved because of the 1135 emergency waiver. So keep in mind, like if you use Medicaid and you're going to the doctor or you have services that are kind of medical in nature, this is based on that kind of coverage. So prior authorization requirements are temporarily suspended. Pre-existing authorizations are extended. The screenings that they do and the annual reviews that are required are suspended. The state hearing request and appeal timelines, those aren't as tight as they were, they're modified. There have been modifications around who can provide services and then also where they can be provided. There are some alternate settings that are available. And if you really want to get down to the details of what this looks like, There's a link at the bottom of this slide where additional information can be found. It has all the details about the flexibilities for that Medicaid health insurance, the flexibilities there. And we are going to send out a copy of this PowerPoint after the presentation, as well as a recording. So you'll have it in your hands, and we're not just going through it quickly here without providing it to you for additional detail. Okay. We talked before too about how we're using telehealth in ways we never have before. And when the COVID-19 crisis really started taking off in March, Seema Verma, who heads up CMS, the federal agency over Medicare and Medicaid, came out and just said, hey, you know, in Medicaid, there already was a lot of telehealth provision, but now there's even broader flexibility. And it's not just for those who are sick with COVID-19, who can't go into the public, but it's for those who are unable to go because of quarantine. You know, we can't access clinics. I actually was talking with my son's pediatrician yesterday, and if you're sick, you can't go to the pediatrician. Like, you have to be seen via telehealth. They're only doing well visits. So telehealth is so important right now. And fortunately, in New Jersey, action was pretty swift early on, and the governor announced all the agencies really were going to be required or strongly encouraged to provide telehealth in the services that they provide, you know, through Medicaid, through private health insurance, through the waiver services that you all receive. So that's something that has been rolled out. I'm guessing it's not perfect. I know, you know, I think, for instance, like the behavioral support that my son gets, usually he gets hours and hours a day, and now, you know, he might get 30 minutes or an hour a day, and we've worked our way up to that because it's just not something that he really wants to engage in. It's very hard work for him. So it's working somewhat. It's like a tiny Band-Aid for some, and as I said, for others, you know, it's great. So it's a temporary situation that's helping. But we do want to recognize that, you know, it's not ideal for everyone. It can be utilized for the standard evidence-based supports and services for autism, the behavioral health treatments like applied behavior analysis, therapeutic services, things like speech, OT, PT, and then those critical psychological and psychiatric supports. Those are so important right now. Additionally, we talked earlier about discrimination in healthcare and how just across the board, federally and on the state level, we're really trying to make sure that rationing is not imposed upon our community, and that people who have to be hospitalized have the right kind of supports. And fortunately, in New Jersey, there is guidance that a family member can be with someone if they have to be hospitalized. And this is so important. We've heard stories around the country where this has not been the case, and it's just catastrophic for our community. You've got to have the right supports. It makes the job of the healthcare providers better, and of course, the most important thing is the quality of life for the person who has autism, who's accessing treatment. So thank goodness that has been clarified. All right, so home and community-based services. Those are the services that you receive through your waivers, like your community care waiver. And it's interesting, when the pandemic really began escalating across the country, early March, CMS came out and they were reminding everyone that there's a remedy during a national emergency called Appendix K, and it applies when there's a national emergency. And so we've seen now more than 40 states be approved for Appendix K flexibilities in their waivers. And so it allows for alternate settings. It allows for parents to be reimbursed as providers during this time, those kind of flexibilities. New Jersey is not one of those 40 states that has been approved. So I don't know if it's in process or if New Jersey is not pursuing Appendix K. But what I do know is that the Department of Human Services has provided, you know, direction to the community. As you all know, you're experiencing it. The day programs were closed. There's bridge payments that are being provided to the day programs. There are enhanced payments to group home providers. There are modified rules to quickly allow families and providers to hire workers. This all sounds really great, right? I'm sure it's working wonderfully for you. We've had to restrict visitors to group homes to reduce risk. PPE has been delivered. There's guidance on requirements surrounding hygiene, just trying to stay healthy during this time. I know that New Jersey does have a dashboard on their DDD website, on the Department of Human Services, that monitors the group homes, how many individuals have been diagnosed with COVID-19, and how many deaths there have been in those group homes from COVID-19 and in the community. So that's very interesting to track. It's heartbreaking to track, but it's important that we have this information. There was just announced recently a $3 per hour wage increase for direct support professionals that are in those group home settings. I have heard from some of the community about concerns about those who are doing self-direction and if that applies to staff there. And so there's ongoing advocacy around that. If you want to read more detail about just some of the things that are affecting your waiver, your home and community-based services, your community care waiver through DDD, there are a couple of links at the bottom of the page I encourage you to visit and just read. They are doing weekly, DDD is doing weekly updates, just providing data about how many people have been diagnosed, things that they're doing to support the community. I know it can be frustrating at times, but it's good to stay engaged and just to hear what they're doing. All right, so with regard to special education, New Jersey Department of Education has acknowledged on their website it's a temporary situation and that appropriate services, they need to try to provide them to the best of their ability, and they may need to consider compensatory services. I think, you know, it's interesting that they use the word may, and I know it's a great concern to our community, and they're trying to focus on a case-by-case basis, but we know that means it can be good because, of course, services need to be individualized, but it also can be catastrophic as there's so much disparity between towns, between schools. There is information on the website. I put a link here with just Q&A information about what their policies are during this time. So if you have time, which I know is hard right now, if you're trying to work from home and you have a child or an adult with autism, visit these links and read those Q&As. There's information for you there. We know the situation with early intervention and special education is confusing and challenging. I wonder how many times we said the word challenging in this webinar, but it is challenging. It's like an unexpected challenge on top of the challenges our community already faces. But there is good news. When the COVID-3 federal legislation passed, there was funding included, Dave mentioned it earlier, through the Education Stabilization Fund. And the numbers that you see here are numbers that are allocated to the state of New Jersey. So for instance, K through 12 received $303 million. There are different categories that money is being allocated to. Special education is in there as one of the categories, but the money is being allocated through formulas. They're kind of pre-established, but that's money flowing in. There's money for post-secondary education. And then we're focusing on money that's coming in through this governor's discretionary line. So Governor Murphy received $68 million to utilize for education. And you can utilize it in various ways. It's supposed to kind of focus on disparity when he's utilizing these funds. So Autism Speaks is trying to work to advocate that these funds specifically, solutions be focused around access through hardware, software, communication devices, assistive technology. We're so worried about our community. Some people having really good access to Wi-Fi and the equipment they need to engage, others not. You know, when you have a family and parents are trying to work and you have multiple children and you have a child on an IEP, just trying to participate in that remote learning is going to be challenging. And if you don't have access to Wi-Fi, if you don't have an iPad or a computer, it makes it even harder. We're super worried about the transition from early intervention into special education. We want to make sure that the little ones that are coming in are properly supported and not just shoved into a system that's not ready for them and they're not ready for. We're very worried about services and supports that our community is not receiving right now. We know that they're talking about compensatory services later and what they might provide later, but what we'd like to encourage is that the governor use some of the $68 million now to provide services now. Even though they're looking at school closures and no one's talking that much about extended school year, services could be provided now through this funding. And then the other and final priority that we've been focusing on is just those that are aging out of the system. What does that look like? We do not want students exiting because they're aging out if they have not received the appropriate supports and services to be ready to transition into the adult world. And so we'd like to make sure that their time is extended if at all possible so that they can access the services that they should prior to transition. So that's a lot. I know we kind of threw a lot of information at you, but we wanted to share with you what we're thinking about on a state and federal level. We do want you to stay in touch with us. We have social media platforms that are specific to advocacy on Facebook, on Twitter, on Instagram too. And if you're not into social media, good for you. Take a break. But you can visit our website, go to autismspeaks.org/advocacy, and you'll see our news items and all the relevant information there too. So thank you all so much. And there, I see we have a very special guest. Awesome. All right, Stuart, are you with us? Or Dave?
I am.
Okay, Stuart, I'm going to turn it over to you quickly.
Hi, Representative Smith. This is Stuart Spielman. I'm Senior Vice President for Advocacy at Autism Speaks, and it's my great pleasure and privilege to introduce Congressman Chris Smith to this call. Congressman Smith is co-chair of the Congressional Autism Caucus, and he has been with families with autism and autistic individuals for more years than I can possibly count. Congressman Chris Smith was the sponsor of the Autism Cares Act, and I can't even begin to describe Congressman Smith's advocacy on behalf of our community. It's been incredible. Thank you, Congressman Smith, for joining the call.
Stuart, thank you so very much. And thank you to all of you. I'm sorry I'm a little late. We're in between votes today, but thank you for the great work that you do, all of you. But Stuart, we've worked so closely with you for so many years. The meeting's right here. I'm in my office in Washington now, where we scope out what our next steps are, who do we need to talk to. Thank you for your expertise and your just tenacious attitude. It makes all the difference in the world. And of course, to all my friends back in New Jersey, and particularly in the 4th District, but all of New Jersey, thank you for your advocacy. It makes all the difference in the world that you are pushing so hard, particularly for NIH funding, CDC, and of course, HRSA monies, which thankfully, we have seen a huge rise over these last several years, and of course, Autism Cares has helped in that regard. But it's an annual battle, as we all know, to make sure the appropriations level either matches or exceeds the authorized level. As you know, there's a two-pronged approach to how we legislate here. I think it's deliberately designed to confuse and confound people outside the Beltway. But we have great friends. The Autism Caucus, and Mike Doyle and I, you hear about the lack of bipartisanship. We work together like brothers, and it makes a difference. We talk to different people. I get along, believe it or not, very well with the speaker. I have lobbied her many times on issues related to autism. She is very responsive, and ditto for Kevin McCarthy, who is our minority leader. He may be the speaker someday, who knows? But he too is totally plugged in to the importance of autism, persons with autism, services, and of course, the basic research that will lead to unlocking many of the problems still faced by our young people as well as those who have aged out. We have put a big emphasis on aging out, Stuart, and all of you know that. I've had hearings that I've chaired on job opportunities, the importance being that so many of our persons with autism are very employable. Not only employable, they do a tremendous job. They are total assets to their corporation. I remember I had a hearing with SAP, and they started off hiring some young people, so young adults, because their parents who worked at SAP said, would you give them a shot? It very quickly became evident that it became part of their business model because they were so focused and so effective when it came to writing code and doing other chores for that huge tech giant called SAP. And I push the labor unions, I'm a pro-labor Republican, to be more inclusive, as well as the Chamber of Commerce. And I talk to them frequently and have a meeting with set up. We're going to meet face-to-face with their executive director, who used to work on Capitol Hill, to see what more they could be doing as well. So everybody's joined. We do have a bill up today, which is problematic. It has some of the language that Mike and I, which came from you, on FMAP, an increase in FMAP, and some of the other provisions, not all of them that we had asked for. But you have to know this is a mere opening salvo in what will be the next bill. I read the entire bill. I sat down a day and a half ago. It's 1,800 pages plus. It is a 90-page summary. It has not been subjected to congressional hearings, which I think is a mistake. We learn from each other. I've chaired 500 congressional hearings, including hearings on autism. I've been in the majority for 40 years of my tenure in Congress and in the minority for 40 years. No matter who's holding the hearings, it does provide insights. What can we get right? What can we get wrong? So we don't miss the big and little picture of any given issue. None of that happened here. There's no CBO score. We don't know what it would cost. But there's also some language in it that I found very troubling. And it has to do with disqualifying those children, young adults, students, who go to private and parochial schools. We got a letter, members late last night, because they found that in the small print of the bill, about 10% of the population that go, I'm very much for public school. I'm also for Catholic and Jewish and private school as well. It's all about the student, and they are excluded in this language. So there's a very, very strong letter from the United States Catholic bishops, as well as from a whole lot of the faith-based schools, because it says in pertinent part, if passed, these provisions, this is in the HEROES Act today, would eliminate from eligibility for aid almost all students enrolled by their parents in private schools. This would represent a stark departure from 55 years of precedent under federal education programs, including ESEA and the Individuals with Disabilities in Education Act. It also points out it excludes almost all private school students. And, we should be, when we went through, this is like a stark reminder of what we faced when Superstorm Sandy hit. There was a major effort made by FEMA to exclude faith-based schools. One of them was St. Rose in Belmar. We were told that they were not going to get the assistance that every other school, and previous to that, every natural disaster had provided under FEMA.
Hey, Congressman, can you hear me? I think we may have lost your audio.
We're missing a lot of good stuff too. Okay. Please stand by, everybody. We'll work to get this fixed. And thank you for your patience. Just hold on 1 minute, everyone. We'll work to get this corrected. Just stand by, everyone, for 1 minute. If you don't mind, we'll work to get this audio issue corrected. Thank you for your patience. Oh, there we go. Stand by, everyone, and thank you for your patience. Still no. Oh, Friday afternoon technical difficulties. Okay. All right. I think what we'll do is let's move on to talking about the supports and services that we provide at Autism Speaks. And then if we can get this issue resolved, we'll get right back to the Congressman. So I'm going to actually turn back over to Jenny Green. For those of you who asked questions, if we don't get to those during this time, please just let us know in the chat box and we will reach out to you after the presentation. And then also you can email us at help@autismspeaks.org. All right, Jenny?
Yeah, absolutely. So I just wanted to touch a few minutes on the COVID-19 information and resources, because as Judith mentioned earlier, you know, we have so many families that are directly impacted in very significant ways. So Judith, you've talked about some of these challenges that parents are facing right now. Thank you. So we'll just reiterate the autism response team. Judith did talk about them earlier, but I just wanted to go back over the autism response team. These are specially trained staff members that provide personalized information for everyone. They provide guidance and resources for family members or even individuals on the spectrum. They can also answer questions and connect you with tools and resources locally in your community. And again, they do have a dedicated Spanish hotline, as well as our toll-free number. And you can email them. It's a simple email, or you can always call them, but it's help@autismspeaks.org. So Judith, next slide. So I did want to mention that also, we do have, actually, can you go back to the, oh yes, no, this slide is fine. Sorry. So I just wanted to mention another great resource to visit is our Facebook and Instagram channels. So we do have local Facebook groups in your area. So I do suggest that you go and join your local Facebook group in your area. And then last, on the bottom section here, earlier this month, the Autism Certification Center and also Autism Speaks teamed up to make over 30 hours of online video learning available to the autism community at no cost. So I do want to let you know, I'm taking the courses myself and find it very helpful. And then last, I'll just touch base before we continue, if you want to go to the next slide. So as we mentioned earlier, there's many resources on our page. You're going to see the help and information topic line here. We've made it very easy for you to find information. If you simply hover over the help and information, you'll see a drop-down box. And when you click on it, you're going to see this page here. And we've actually divided this down into categories, so it's easier for you to find the information that you want. So down in the bottom there in blue, you're going to see things like financial planning, safety and technology, and also, you know, transition to adulthood, just to mention a few. So that's really all I have to touch base with, Judith. So I'll turn it back over to you.
All right, and I do think we have audio now with Congressman Chris Smith, so thank you everyone for waiting, because it's well worth the wait. Congressman, we apologize for the technical difficulties. Thank you for sticking it out with us.
Oh, thank you, Judith.
Hey,
thank you for
your voice. Awesome.
Can you hear it okay? I'm sorry.
We can hear you.
Thank you again
for
doing this. I'm not sure where it kicked out. I wouldn't want to repeat.
You were talking about the parochial schools, the funding related to parochial schools, and then I think we lost you after that.
Okay. Not to belabor the point, but there is language in this bill that would exclude all parochial school students from, and that includes, you know, young people with autism from any services and money inside this bill. So it's a radical departure, and as virtually all of the private and parochial schools have said in a joint letter, it's unprecedented. We've never seen this before, ever. So the next bill, and there will be a next bill, and we will fight to keep, you know, the FMAP and the other enhancements that are in this bill. We'll have that shot at fighting to get that right. And I'll just be very brief on this, but I did mention reason for some hope with regards to umbilical cord blood stem cells. I don't know if I got into that before I was cut out,
No.
you know, or whatever. Well, in 1981, I introduced a bill to provide funding to create a brand new program for umbilical cord blood stem cells, and we combined it with bone marrow a couple of years later. But they're very hard to get because it requires an intrusive procedure, but a loved one and finding a match is even harder. Not so with umbilical cord blood stem cells. It's law. It was signed into law in the year 2005. And the reason why I bring it up, Dr. Kurtzberg from Duke sat right in my office here on 9/11/2001 when we got hit over World Trade Center, of course, right here, at 8 o'clock in the morning. And we worked on the text of that bill. She had some great insights. Like Stuart, providing insights as to what legislation and policy should look like. And here's why I bring it up. Dr. Kurtzberg and I have worked together, and she now has taken on a major study on providing umbilical cord blood stem cells, which are very safe. It's like getting a blood transfusion. They are very safe, but they're also showing great efficacy when it comes to ameliorating a number of the signs of children with autism. She did it on a group of younger people. There were 25 in the study. It's already been published. And now she's expanding it significantly to include people who have aged out, young adults to see whether or not it'll have that ameliorating effect on them as well. She got a multi-million-dollar grant from the Marcus Foundation, and that's helping obviously provide the wherewithal. But just I bring this up from a situation of hope. Cord blood stem cells are like among the best of all the adult stem cells. There's no rejection. They don't become tumors like some stem cells do. But most importantly, they provide some hope. She's the first one to say, don't get too much hope until we prove it. But she's already proven it with 25 young people in her study and has already published. So I just raised that as, and I've talked to Stuart about it. I think it's reason for hope that, you know, when I offered the bill itself back in 2001, again, 5 years before it got passed, but it passed by the Senate. And we even had Dr. J, Julius Irvin, because he headed up the Sickle Cell Anemia Foundation. At one of our press conferences, over to my right, there's a basketball he gave me. And I said, I love the fact you're giving me a basketball. Get it over to the Senate, because they got the holds on it. He did. He went over there. And he was giving out basketballs like cotton candy. But it made a difference. And it is making a difference. But the application that I think is there, you know, from medical waste, umbilical cord blood, and placentas are thrown out, as we all know. Now they're being turned into medical miracles for at least 80 different diseases and disabilities. Sickle cell anemia, as I mentioned, leukemia, many of the blood cancers, but even we think here, based on what Dr. Kurtzberg from Duke is finding. So reason for hope.
Interesting. Very interesting. Stuart, I don't know if you have anything else you want to share. Oh, you're muted, sir.
Sorry about that. No, I just want to thank Representative Smith and Kelsey Griswold for joining us and for dealing with the audio difficulties. It's always a pleasure to see you, sir, and thank you for joining so many of your fellow Jerseyites on this call.
Absolutely.
Thank you.
Yes, thank you so much for your dedication through the years and for thinking innovatively and sharing that with all of us. It gives us hope. It means so much, and we deeply appreciate it. I think with that, we're right at the top of the hour. So with that, thank you for pursuing a solution to the audio so that we could all connect with you. We appreciate your time today. We're going to be watching that vote today too. We will all be back.
Remember, it's not the last vote. This is a step. We need hearings, as I said before, and we will come up with a bipartisan bill like we did previous to this, and we will fight to get all that language into it, the good language that affects in a positive way our children and young adults with autism.
Thank you, and we appreciate your leadership in the caucus and, you know, all the way that you've expressed what's important to our community. It means so much. All right, everyone, so I want you to know we're going to circulate a recording of the webinar and a copy of the webinar after this for all of you who have attended, and we're going to stay in touch. So we will keep you posted, and hopefully next time we all gather like this, we will not have audio issues, although we powered through. We figured it out. Happy Friday, everyone. Yep. Thank you so much for your time today. Please take good care. I hope you all have the best weekend that you can. Thank you.
Thank you, Judith. Thank you, Stuart.
Thank you.
Bye-bye.